I have a son who has severe food allergies, and he got the food allergies back in '09, August 25th, 2009 to be exact. And I have literally, from that day forward, have been on a mission trying to figure out how did my son get these food allergies. I found out that our food supply is genetically modified. And guess what? The food that my son ate on August 25th, 2009 was raw corn. The corn that almost killed him. All I could hear him go is and like itching. I'm like, what the heck is going on? And he has turned red. He couldn't breathe properly. I was in panic. I called 911. I was just like, I think my son's having a food allergy attack.
It's okay.
And I immediately took him to the doctors, and I got all these tests done, and sure enough, he's deadly allergic to corn now.
25, 30, 35 years ago, no one was allergic to anything. And now you have allergies. I have people with black pepper that couldn't have black pepper today. There's, celiacs that have wheat, gluten allergies. People that have allergies to, of course, the basics like dairy and seafood, but everything. I have people that are allergic to parsley and just regular natural chlorophyll plants.
We're talking about food. Foods become harmful. How did that happen? So when you link it to the GMO issue, it resonates like you would not believe.
Patients with allergies, I try to keep them away from GMO foods because they'll react to them, and they'll tell you that.
It's my fourth child who has food allergies. We have no family history of this. I knew that I had taken care of myself through every pregnancy the exact same way. And as friends kept saying, what did you do differently? What did you do differently? I had no answer. And suddenly, in learning of this relationship between GMOs and food allergies, I finally had my answer. And in learning about genetically modified foods, I was also able to do something about it. And literally within a 24-hour period, we cleaned out the entire kitchen. There were the items that we had been feeding our children for the last 6 years, we just literally threw into the trash. And so at first, where I was excited and I was relieved at having discovered all of this, I then went through a really hard stage where I just cried because I thought, what have I done to my children and what has been done to them without my consent?
And I have kids who are allergic to every food group. How is that possible? And not just a few of them, quite a few of them. Almost impossible to manage. Moms are coming and saying, what do I feed my kid?
I have seen firsthand exponential growth in allergies. And yet, when I improve the quality of my patients' diets, meaning prescribing a non-GMO diet, prescribing organic food, their symptoms go away.
In most of my patients, because they have some sort of immune or inflammatory response to the GMO foods, I have to take them off of the non-GMO foods that are related. So I have to take them off of all corn. I have to take them off of all grains because my experience is that once the immune system has been inspired to have a response, that they react, to GMO and non-GMO.
Now, I had a healthy patient come in, 30-year-old woman, who told me now when she eats any food, her skin literally overheats. Literally anything that she's eating is causing a problem in her skin. And she says to me, what could this be? Well, what we do is we take her off of all of the food that she's eating, and she starts back adding in highest quality organic foods in their base forms, right? As she's doing that, she suddenly is getting better. We might have to use enzymes or other things to help her, but as she starts to get better, guess what? When we add back in corn or soy, she can consume it if it's not genetically modified.